Welcome to the deep dive. You ever wonder if maybe those habits from your 20s, skipping the gym, maybe a few too many late nights, do they actually cast a long shadow?
Yeah.
Today, we're actually digging into some really interesting research. It tracked people for, 3 decades?
30 years, yeah.
Right? To see how those early lifestyle choices really hit their health down the line. So our mission, basically, is to unpack this unique long-term study.
Exactly. We're looking at a study published in the Annals of Medicine. And what's really cool about this one, I think, is that it followed people right from early adulthood. They started checking in at age 27.
Oh, wow. That is different.
Yeah, most studies tend to start much later, middle age maybe. So this gives us a pretty valuable perspective.
Right. So instead of just looking back from middle age, they watched it happen. And the initial picture seems pretty clear, right? That these, let's say, less than ideal habits in your late 20s, early 30s could lead to noticeable kind of bumps in the road, both mentally and physically, by your mid-30s, as early as 36.
That's what they found, yeah, as early as 36.
Okay, so how do you even set up a study like that? 30 years is a long time to track people.
It really is. It was what we call a longitudinal study. So following the same group over that whole time, these folks were born in Jyväskylä, Finland, back in 1959.
Okay.
And the researchers checked in with them at key points, ages 27, 36, 42, 50, and then finally at 61, gathering all sorts of health data each time.
Right. So not just asking, how are you feeling? How did they actually, get a handle on something like mental health over decades?
They used established survey methods, looking at depressive symptoms and also overall psychological well-being. Both of those were measured on a scale 1 to 4. So, for depressive symptoms, 1 might be feeling pretty good, 4 may be indicating more struggles.
Makes sense. And physical health.
For physical health, they calculated something called a metabolic risk score. Yeah, that one's on a 0 to 5 scale. It looked at things like blood pressure, waist size, blood sugar levels, cholesterol, other fats in the blood. Basically, a higher score means more risk for metabolic problems.
Gotcha.
And they also just ask people straight up, rate your own health over the last year, 1 to 5.
That seems pretty thorough. You've got the objective stuff and also how people actually feel about their health.
Exactly.
And at each check-in, they were also tracking 3 specific, maybe risky behaviors. What were those?
Right. They focused on smoking. Didn't give a super specific definition for how much smoking, just whether people smoked or not.
Okay.
Then heavy drinking. They did define that one pretty clearly. For women, at least 7,000 grams of alcohol a year, which is about 875 UK units.
Right.
And for men, 10,000 grams, so 1,250 units per year.
That's quite specific. And the third one?
Physical inactivity, defined as exercising less than once a week.
Less than once a week. Okay, so we've got the setup, the measures, the behaviors. Let's get to the core findings. What happened when they looked at just those single snapshots in time?
Yeah, this is pretty striking. Even when they just looked at any one of those check-in points across the 30 years, the people who were doing all 3 of those things, smoking, heavy drinking, not much exercise, they consistently showed, worse mental and physical health compared to the folks with healthier habits.
Consistently worse. Can you, put some numbers on that for us?
Yeah.
What kind of differences are we talking about?
Sure. So compared to the healthier group at any given time point, those doing all 3 risky things had, on average, a 0.1 point increase on that 1 to 4 scale for depressive symptoms.
Okay, 0.1. Doesn't sound huge, but maybe it adds up.
Well, exactly. And it's an average, but consistently feeling even a bit worse can matter. Their metabolic risk score, that 0 to 5 scale, went up by an average of 0.53 points.
Okay, that's over half a point.
Yeah, which can be an early sign, right, for issues with blood sugar, cholesterol. Psychological well-being went down by 0.1 points, same scale as depression, and their self-rated health dropped by 0.45 points on that 1 to 5 scale.
So even at one point in time, you see a clear difference across the board, really.
You do.
But this was a 30-year study. So they could see what happens when these behaviors stick around long term. And that's where it gets even more interesting, right?
It really does. And, kind of as you might expect, the cumulative effect, sticking with these habits for decades, it was much more pronounced.
Right.
Those individuals who consistently, over the long haul, did all 3 risky behaviors,
Yeah,
they saw even bigger declines.
Okay, lay those long-term numbers on us. How much worse?
So over the long term, depressive symptoms went up by, on average, 0.38 points. Remember, the single point was 0.1.
Yeah, nearly 4 times higher increase.
And the metabolic risk score, that jumped by 1.49 points.
Whoa, 1.5 points. That sounds significant.
It is. A sustained increase like that really ramps up the risk for serious health problems later on. Psychological well-being fell by 0.14 points, a bit more than the single point, and self-rated health. Interestingly, that declined by the same 0.45 points as the single time point analysis.
Yeah. Still a drop, but the metabolic risk jump is the big one long term.
Absolutely. That really highlights how these things can compound, just build up over time.
Yeah, snowball effect. Now, did they tease apart the individual behaviors? Like, did smoking affect things differently than, say, not exercising?
Yes, they did look at that and found some, well, interesting distinctions. Lack of exercise, for instance, seemed particularly strongly linked to poorer physical health.
Makes sense. Cardiovascular health, weight.
Exactly. All that stuff we know activity is crucial for. Smoking, on the other hand, was more strongly linked to poorer mental health.
Why might that be?
Could be neurological effects of nicotine, maybe the stress response tied to smoking, dependency. Could be several things.
Okay. And the heavy drinking?
That one seemed to hit both. It was associated with declines in both mental and physical well-being.
Right. That's maybe less surprising. Alcohol affects so much.
Pretty much.
And a key thing they noted was when these effects started showing up, wasn't it?
Absolutely. They really emphasized this. These negative effects, both mental and physical, were already apparent when people were just in their mid-30s.
Mid-30s. That really drives home that the choices you make, in your late 20s, they can catch up relatively quickly.
It seems so. It's not just something you worry about when you're 60.
Right.
Yeah.
Now, lead author, Dr. Tia Kekäläinen, she studies aging, right? What was her big takeaway from all this?
Yeah, Dr. Kekäläinen really looked at the broader public health picture. She pointed out that things like heart disease, stroke, some cancers, non-communicable diseases, they're the biggest killers worldwide.
True.
And she stressed that, a healthy lifestyle is just such a powerful tool. It really cuts the risk of those conditions, gives you a better shot at a longer, healthier life.
A fundamental point, really. What else did she emphasize from this specific study?
She really hammered home the importance of tackling these risky behaviors, the smoking, heavy drinking, inactivity, as early as possible.
Why early?
Her thinking is if you address them in young adulthood, you can actually prevent that cumulative damage from building up in the first place. It's about, stopping the snowball before it gets too big.
Get ahead of the curve. Okay. But it wasn't all doom and gloom, all right?
Yeah.
She had a more positive message, too.
Definitely. She was very clear. It's really never too late to switch to healthier habits.
That's good to hear.
Yeah, even if you start making changes in midlife, you still get significant health benefits down the road. So, there's always value in making that shift. It's a hopeful message.
Absolutely. Now, like with any study, we need to be careful. Look at the limitations. What did the researchers themselves flag?
Well, one key thing is this was an observational study. Meaning they saw strong links or associations between the behaviors and the health outcomes, but they can't definitively prove that the behaviors caused the bad health.
Okay. Correlation, not causation.
Exactly. It's possible other factors are involved, or maybe the relationship goes both ways.
Can you give an example of that, like two-way relationship?
Sure. They actually gave one. Someone under a lot of stress might start drinking heavily to cope.
Right.
But then that heavy drinking might mess up their relationships, which then makes their mental health worse. So you see, it's not just A causes B, it can be more tangled.
Yeah, life's complicated. Makes sense. What about who this applies to? It was people in Finland born in the late 50s.
Good point. And they acknowledged that. The findings are probably most relevant for people born in Finland and, similar Western countries around that time, late 50s, 60s.
But maybe not directly applicable to, say, millennials or Gen Z.
Potentially less so. Cultures change, societies change. Maybe the main risky behaviors are different now for younger generations. They flagged that as a potential limitation.
Okay. Anything else they pointed out?
Yeah, a couple more things. The study basically treated all three habits, smoking, drinking, and activity, as equally damaging. It didn't try to weigh them differently.
Okay.
And also it focused just on those three. It didn't include other really important lifestyle factors like diet wasn't part of this specific analysis.
Right. Diet's a huge one. Yeah, and just for listeners who might want to find the actual paper.
Yeah, it's called Cumulative Associations Between Health Behaviors, Mental Well-Being, and Health Over 30 Years. Lead author Tia Kekäläinen. It's in the Annals of Medicine, published April 24th, 2025.
Great. So let's try and wrap this up. What's the big picture takeaway from our deep dive today?
I think the central message is pretty clear. How you live in your early adult years, specifically around smoking, drinking, and activity, it genuinely has a measurable impact on both your mind and your body by the time you hit middle age.
And it's not some far-off effect. We're talking changes potentially showing up as early as age 36.
Exactly. And it's not trivial, especially long-term. Consistently doing all three unhealthy things was linked to, remember, much bigger increases in metabolic risk and depressive symptoms compared to healthier habits.
But, and this is important, remembering Dr. Kekäläinen's point, making healthier changes whenever you make them, it still helps.
Absolutely crucial. It is truly never too late to start making choices that support your health long-term.
So maybe something for you, the listener, to think about as you go about your day. Which of these lifestyle factors kind of resonates most with your life right now? And maybe what's one small change you could make starting now that might just pay off big time for your mind and body down the road? Definitely some food for thought. Thanks for joining us for this deep dive.